Thank you, Madam Vice Chair. Structural racism and systemic biases have shaped our responses to addiction, which has resulted in the criminalizing and the devastating of whole communities for decades. I do believe we perpetuate those practices when we ignore and leave out of the conversation and the profile of who's been impacted by this public health crisis and epidemic. Expectant mothers, when we leave out the Black and Latinx communities, and when we leave out those that are incarcerated. Again, one of the groups most at risk of opioid-related deaths is women, and pregnant women and new moms have been especially vulnerable. The CDC found that the number of pregnant women with an opioid addiction more than quadrupled in the last 15 years. And for these new moms experiencing addiction the year after childbirth is the deadliest. Mr. Carroll, what is ONDCP doing to partner with HHS to improve comprehensive health services, particularly for postpartum women who are often most susceptible to relapse and opioid-related overdoses?
One of the things that's important to do is to make sure that we're reaching every community that is out there. You mentioned the incarcerated, and let me start with sort of in the order that you went. You were talking about the population that's incorcerated. And
we can go there. I'd like to stay on the moms right now.
I'm trying to answer your question.
Okay.
And I'll get there, I promise. What we're trying to do is, like for the incarcerated population, sadly in many communities, those are the facilities that provide the most treatment for individuals. So that needs to change. But it changes at the fundamental level of making sure we're not criminalizing addiction, and so that fewer and fewer people are going to jail. We're doing that. We did an additional $4 million in drug court diversion, so they're not going to jail. They can get treatment on the outside. In terms of—
I'm sorry, so yes or no, does that mean that ONDCP is working with the Bureau of Prisons to expand access to medication-assisted treatment for incarcerated people, since we know that 2/3 of all incarcerated people suffer from substance abuse disorders and only 1/4 of those people receive any drug treatment?
One of the things that's important to do, and we talked about this
yes
earlier—
or no? Do you have a partnership? I'm sorry, I have a limited time. I want to be respectful.
And I'm trying to be respectful too.
Okay.
What we're trying to do is expand the number of prescribers, because once we have a bigger workforce, we can get more people into an incarcerated population to provide them the treatment that they need.
And what about those reentering, since when those are reentering society, they're 40 times more likely to die from an opioid overdose? And
there are some local jails that are doing this. We're trying to incorporate it at the federal level as well.
Okay, very good.
But
Thank
one
you.
of the, it's important—
I'm short on time. I want to get to my question about moms.
In terms of mom, that is one of the saddest things that you see, is when you see a child who has NAS and they truly have that pain. And so the idea is making sure that we're having specialized care for them with HHS to make sure, such as Lily's place in West Virginia that we talked about, and other places, to make sure that we're going right at— we have to treat these as individuals.
Excuse me, I'm sorry, but at the same time, you're intent on overturning the ACA, rolling back protections for pre-existing conditions, and undermining the expansion of Medicaid, which can be a critical source for addiction treatment. So yes or no, will this administration's attack on the ACA and efforts to stop Medicaid expansion help tackle the opioid epidemic?
The failed policies of health insurance does not actually mean health care. And I think it's important that we understand that at the outset. We have to make sure, and it's my responsibility to advise the president on making sure that as the reforms go forward, getting treatment to individuals is the most important thing that I can do in terms of helping, whether it's moms who have an addiction, parents, children, or anyone. That's my responsibility, is to make sure that we have a healthcare system.
I'm sorry, I
that
just
works.
want to be clear, because mothers are dying. Do you believe the administrator's efforts to undermine the ACA will help end the opioid crisis?
I believe that the healthcare policy going forward will save more lives. Absolutely. We're going to make it a sound policy.
Okay, we just disagree on that. Okay, in my home state of Massachusetts, the opioid crisis is robbing the lives at a rate that is 2 times higher than the national average, and the death rates in Black and brown communities are spiking at record rates. Yet these communities most at risk are less likely to have access to critical services and medication-assisted treatment. Mr. Carroll, what is ONDCP doing to ensure that Black and Latino communities are not left behind?
One of the things that we have to do, as I talked about a minute ago, was to make sure that there's not stigma in terms of the population, the prescribing population, and make sure that we're getting treatment and facilities that provide quality, effective care. Sometimes we've seen in communities, especially in urban areas, are methadone clinics that are not providing quality care. What we have to do is make sure that there are qualified individuals out there providing
and also culturally competent. I just wanted to add that. And then just for the balance of my time, just we don't have much time for you to answer, but I just want to say on the record, your administration has indicated that they plan to eradicate and end the HIV and AIDS epidemic in the next decade. And so I do hope that that this is a part of that broader strategy, since we do know a number of the new infections. There is an overlay in all of these issues.
God bless you. I hope you're right.
Okay.